Morning. Okay, thank you very much tonight for joining us. This is the BHS Health Education Consult Online, and we help people to resolve all the health questions, concerns that people face, as far as health challenges are concerned. So this is a forum where we bring on board health professionals, that is nurses and doctors, who will be able to speak and share very wonderful questions and solutions that many people are encountering as far as this is concerned. And so my name is Robert Metolunu. I'm the founder, owner, and director for Brigham Healthcare Services. I live in Accra, Ghana, and Brigham Healthcare Services office is located at Latibia-Koshi, Sokoto to precise. And as a founder and leader of Brigham Healthcare Services, I manage all the affairs of Brigham Healthcare Services. And I'm a Ghanaian, and I also schooled in Brigham Young University in the US. And I'm also a healthcare advocate. And I've had several extensive research and knowledge as far as the health is concerned. And so this is Brigham Healthcare Services Health Education Program that we are pioneering, and we are working with nurses across Ghana and want to help people to understand several things as far as this is concerned. So we have a list of questions we want our fellow nurses and medical personnel to respond. And so we'll now start with George. We'll start with George. Kindly give a brief introduction about yourself, and then you pick the very first 4 questions we want to touch on. You have all the time. And then after, we move to Eddie. Thank you very much.
Please, I'll be glad if you can repeat the question again.
So kindly proceed with the questionnaire that we placed on the platform, the BHS Health Nurses platform. We want you to touch on 4 of them, responses to that. And then after that, we'll move to Eddie. Thank you very much.
All right, thank you. So I'm Amwako George, a mental health nurse with Holy Family Hospital, still practicing. I'll be answering question 18.
Okay, if you turn on your camera, please.
Okay.
Thank you very much.
All right, so I'm Amwako George, a mental health nurse practitioner with Holy Family Hospital. I'll be answering the question on question 18, which talks about some common symptoms of mental health disorders, example, like depression and then anxiety. Mental health, we say, is defined and refers to a wide range of mental health conditions that affect the person's mood, behavior, and thinking. And there are various types of mental health that we have. A lot of mood disorders, we have anxiety disorders, we have personality disorders, and some form of psychotic disorders as well. Example is what we call schizophrenia, post-traumatic stress disorder, anxiety disorder, borderline personality disorders. Now, mental illness comes with a lot of symptoms that make it quite peculiar for you to be able to identify that this person has it or not. And these are what we call signs and symptoms. And I would like to mention a few and a hand of them, which are most common to us. The first thing that we take notes of is one, putting up an aggressive behavior or behavioral changes. And the individual tends to behave abnormally beyond what he or she is supposed to do. So he's a calm person, and the next thing you realize he's very aggressive, very uncooperative, causing harm to himself and others. That is suicidal and homicidal ideas, trying to doing things beyond the normal means as expected of him or her. The other things that has to do with some of the signs and symptoms also has to do with persistent feeling of sadness that is quite peculiar with people with depression. So persistent feeling of sadness, emptiness, and hopelessness. So the individual finds himself in a situation where he feels sad all the times without any explanation or without any external stimuli. Sometimes too, there are some external stimuli that are responsible for that. Also, the person loses interest in previously enjoyed activities. It's what we call anhedonia. So previously, the person enjoys watching football, watching telenovelas, speaking to people, having a chat. But when the person has what we call mental illness, all those things goes away. He doesn't have interest in them again, especially when it comes to depression. Also, there is loss of energy and loss of energy and fatigue. So the little thing the person does, the person is really tired, and the person is not even having any bite or anything at all that would motivate him or her to move on or to actually stand up and do his daily activities. Something like keeping a good personal hygiene. The person finds it difficult. So you realize that there is poor personal hygiene too when it comes to that due to the lack of the loss of energy. Also, there is difficulty concentrating and also making decisions. So you realize that the person can't take decision for himself because the person is unable to concentrate. And this is mostly due to the fact that there are lots of thoughts and obsessions going on, what we call perceptual disorders, which is going on and it is preoccupying the mind. So there are lots of hallucinations, there are a lot of um, thought contents that are ongoing with the person. So at the end of the day, you realize that the person is unable to concentrate on one thing because of the thoughts in the person's mind and because of how obsessive it is. It becomes very difficult for him or her to concentrate on one thing or the other. Hence, the difficulty in concentrating. There are thoughts of death and suicide. I made mention of it earlier on. You realize that because there are perceptual disorders and things, obsessive thoughts in the person's head, the person tends to have certain thoughts and is unable to control him or herself due to that. And we realize that whenever there is obsessions, compulsions follow behind. Compulsion is just the activity that you are being pushed to do beyond your own control. So as soon as the person, you hear the voices that tells you to actually harm yourself or do something to yourself, you have no other option than to oblige. So there are obsessive thoughts which can lead to suicide as well. There are also withdrawal from social interactions. So you realize that the person previously have good social interactions or interpersonal relationship with others. But for a brief period of time, due to functioning of the brain or dysfunctioning of his mental state, the person tends to actually have withdraw himself from others. So he doesn't have interest in talking to you again. He isolates himself from other activities and other social events, which is much common to other people. There is also an extreme fear sometimes too when it comes to people with anxiety. There are lots of extreme fears that is unexplainable. You realize that the person is afraid of certain common things that you are not supposed to be afraid of. Sometimes even going into people, actually trying to socialize with people. The person have the fear of going into those crowded areas. So you realize that that is also another example. There is rapid heartbeats, which is also another form of physical signs and symptoms that we see. You realize that a person's heart beats frequently. There's a frequent heartbeats and palpitations. That is the medical term for it. So you realize that the heart is beating faster than the normal. This indicates that there is some form of fear that is beyond the other person. Sometimes too, there is sweating and then tremors, what we call trembling in the upper extremities and lower extremities. You realize that the hands are really shaking. and then the person can sweat a lot because of the kind of stimulus he or she finds himself with, which is responsible for the anxiety. There's also avoidance behaviors we mentioned earlier on, that is withdrawal from other people and avoidant behavior. So you realize that this person likes going to church, he likes going to places to enjoy him or herself, but all of a sudden the person withdraws himself without any explanation, and no matter of nothing would actually bring him close to you again. So these are some of the signs and symptoms that the person can actually have. There are also what we call overwhelming thoughts, overwhelming feelings. Sometimes it is unexplainable. The person feels some form of feelings that are more than what he can take. So he feels that people are talking about him, and then people are saying bad things about him, and he has a strong conviction to that. And when it happens that way, it becomes too much for the person, that the person cannot do anything for him or herself. So you realize that the day-to-day activity of the individual is being altered one way or the other.
Okay, so
and also, yes, sir. The next question. Okay, so I'll be taking question 21. That has to do with how one can manage symptoms related to menopause. We realize that menopause is one of the conditions that actually happens to women, and then at their growing age, between the age of 45 to 55, and research has shown that it can come earlier than this particular age. And we say somebody have menopause when he has not had 12 consecutive periods within his months. We know women go through that. And there are a lot of symptoms that person actually experiences. And there are ways you can actually manage the person or advise the person to go through that can actually help a lot. One of the symptoms is hot flashes. So we always encourage the person to be in a room which is really cold or which is well ventilated, so that there will be good ventilation or air passing through the room to make it cool because of the hot flashes. We also advise that the person should also wear clothing that are actually light, especially when the person is going to bed. Light clothing and loose ones as well, so that the air can actually circulate well around the body to avoid those hot flashes. They have what we call night sweats. Night sweats too, which is also important, which is also another symptoms that can actually happen. We actually advise that you keep your bedroom cold. If you have a fan, you can switch it on. That can actually help the individual. There are other things too, which is food that can trigger these night sweats and then hot flashes, which are what we call caffeinated drinks, energy drinks, alcohol, and spicy foods. So at this particular age, when you have menopause, we advise that you either reduce or abstain from those foods to help you reduce such symptoms. There is also what we call vaginal dryness, which is also which is also a symptom that can occur in menopause. We advise that if you are sexually active at that particular point in time, you use vaginal lubricants, which can actually help, or you go in for a more sophisticated type of therapy, which can also help if you can access what we call vaginal hormone replacement therapy. So it will help you go in for estrogen shots, or responsible for menopausal symptoms. You go in for them, and it will help relieve those symptoms as well. We also there are.
So
Next, okay.
Thank you very much. Thank you very much for the question. So let's move on to
Hello, sir. Can you see me? All right. So I'm going to talk to us about sickle cell disease, and it's a well-known cause of a disease that causes a lot of pain to a lot of people who visit the hospital. It's actually a very terrible disease because the pain that people go through because of this disease called sickle cell disease is so much for them to bear. Normally, for us to be able to say that somebody has sickle cell disease, it means that they are having to carry a trait of a sickle cell shaped red blood cell, which causes the red blood cells to clog in the capillaries when blood is passing through to target organs, and it causes pain, especially in joints, and even sometimes perspiration, and causes other organs to fail in a larger extent. Now, for this sickle cell to even start or for it to even happen at all, it means that one person should have to carry a recessive trait either from the mother and another trait too from the father. So somebody can have SS, that's the person having to inherit both sickle cell genes from the parents. The other times too, other person too can have a sickle cell called SC, which is in such a way that the person has one type of abnormal trait called C and another one to called S from the other parent. There are times too another person too can have another trait where beta thalassemia too is involved. They are all very severe cases of sickle cell, and we will look at how we are going to deal with it and prevent it. So sometimes people come to the hospital in severe forms of the sickle cell. Some of the signs and symptoms that one can present with, or even at home before the person comes to the hospital, is one, the person can start having severe headache, the person start having joint pains, the person will start being uneasy or even having respiratory distress because the sickle cell will be blocking certain parts of the body which even needs oxygen, especially the brain, and it can even cause the person to even go into shock. Aha. Then again, you realize that this person might be having a yellowish discoloration of the eyes, and sometimes the person passes urine, which is really, really colored yellow. That you may see that the person is having a crisis of this sickle cell, which the person will need to be rushed quickly to the hospital. So
Okay,
I would want us to look at.
Okay,
yes,
so let's move to the next question.
Okay, so the next question I want to talk to us about is about bone health and how we can improve upon it. It's specifically about osteoporosis. Now, when we talk about osteoporosis, basically it means that the bone density is porous. One major element, calcium, is necessary in making up the bone very dense, and it helps it to be very strong. Now, when we talk about osteoporosis, it means that the calcium levels in the bone are being depleted. Aha. Due to an activity of the bone called osteoclast. Aha, it breaks down the calcium part of the bone. Normally, sometimes due to calcium depletion in the blood, which will cause that. Aha. Now, for us to be able to avert this problem, one has to be able to always undergo frequent exercises. When you undergo frequent exercises, your body tends to understand that the bone mass needs to be improved so that you can bear all these weight-bearing exercise or strenuous things that your body is undergoing. So calcium will also be deposited in this bone for its development. The other times too, you have to undergo exercises that would cause your ankles to be moving, cause your joints to be moving, which will all help to make your bone density stronger. You also would have to avoid certain drugs such as alcohol or even aluminum containing medications. Aluminum has been known to cause a massive depreciation of bone density because aluminum and calcium compete. And we know calcium is the one which is necessary for this bone density. So when we are taking certain antacids such as aluminum hydroxide, we should be careful taking them. Another thing too which can affect our bone density is aging. Especially it happens to our mothers when they are aging because of the loss of estrogen in their blood.
Okay, Eddie, thank you so much. Let's move to Vida. Can you take one question You have a minute, and you also go to Kofi. You also have a minute, and then we'll wrap up. Thank you very much. So please go ahead. So kindly go ahead. We can't hear you. Kindly go ahead. Okay, Dorcas, kindly go ahead.
Okay. I'm choosing my own topic, right?
Go ahead. You just want to just take one question, and then in a minute, kindly do that. After,
Okay.
I will continue. Go ahead.
So I'm picking a topic based on malaria. Hello?
Go ahead. You have a minute. Go
Okay.
ahead.
So first of all, I would like us to know what malaria is. And malaria is a serious disease that spreads when you are bitten by a mosquito infected by tiny parasites. So when the mosquito bites, the mosquito injects malaria parasites into our bloodstreams. So malaria is caused by the parasite, but not by a virus, and it's not caused by any bacterium. So if it is, when malaria is left untreated, malaria can cause severe health problems such as seizures, brain damage, trouble breathing, organ failure, and then it can also lead to death. So who might also get malaria, or who might get malaria? Anyone can get malaria, but people who live in Africa have a higher risk of infection than others. Young children, older people, and those who are pregnant have an increased risk of dying from malaria. People who live in poverty and don't have access to health care are more likely to have complications from this disease called malaria. So malaria symptoms actually appear 10 days to 1 month after the person was or has been infected, depending on the type of parasite, since we have 5 types. So when a person is affected or is infected with this parasite, some of the signs and symptoms that may show are fever and sweating. The person may have chills that shake the whole body. There may be headache and muscle aches. There may be fatigue, chest pain, breathing problems, and cough. And it can also lead to diarrhea, nausea, and then vomiting. So as malaria gets worse, it can cause anemia and then jaundice. The most severe form of malaria, which may progress to a coma, is known as the cerebral malaria. And this type represents about 15% of death in children and nearly 20% of adults' death. So can malaria itself be prevented? Yes, malaria can be prevented. Malaria can often be prevented by the use of anti-malaria drugs and the use of protection measures against mosquito bites.
All right.
What's planning? Okay.
All right. Thank you so much. Thank you so much
Okay.
For this first round of Q&A section. We thank you so much for attending. We are going to have a second round with the same link, and so yeah, you just have to follow the same link in 5 minutes time, and then continue from those who have not been able to attend. So thank you so much for sharing your views and your answers to some of these questions that